Vital signs and verdicts, truth under the scope. Hospital fails when the profits the hope. Lots of price tag on a corporate sheet that let you bleed till the ledure's complete.
Welcome to Vital Signs and Verdicts, where medicine meets the law and the truth gets put under the microscope. I'm Liam, a former hospital administrator turned whistleblower, and your host. I'm joined by our panel. Hope, a former surgical RN who lived through her own systemic failure. Pete, who holds a doctorate in psychology and helps firms pick juries for high-profile cases. And Dr. Tyler, a medical doctor with a Juris Doctorate who has testified in federal court and before Congress.
Before we begin, everything we discuss today reflects our professional opinions based on publicly available information, including the court filings in this case. Nothing here is legal advice, medical advice, or a statement of fact beyond what is documented.
The truth behind Cox Branson's straight A brag.
You've probably seen Cox Medical Center Branson advertising their 3 straight A's from Leapfrog. Billboards, Facebook posts, press releases, they're proud of that grade.
But then someone online asked a simple question: what does that A actually measure?
So we pulled the receipts, we went straight to the Leapfrog site, the same one Cox links to, and we broke down every category, gave each bar a real letter grade, and then looked at why they earned those grades. And what we found tells a very different story. Verdict: the A isn't what you think it is.
Leapfrog's A doesn't mean excellent. It doesn't mean top hospital. It doesn't even mean above average. It means achieve the standard. In school terms, that's a C in my book. You met the minimum.
So we graded Cox Branson the way schools grade students, using their top tier as an A, even though Pete thinks it should be a C.
Yes, I do.
So if they achieved the standard, we will give an A equal to 4 points. Considerable achievement will be a B equal to 3 points. Some achievement will be a C or 2 points. And limited achievement is a D or 1 point. Unweighted, Cox comes out to a low B, but when you weight the categories by seriousness, because wrong site surgery should count more than scheduling, Cox drops to a D.
So under the category of patient rights and ethics, they get a D. All of this information is from the Leapfrog page itself. Billing ethics.
So, what billing ethics actually measures. If a hospital sues patients for unpaid bills, provides clear, itemized bills, offers help resolving billing errors, avoids aggressive or predatory collection practices, treats patients fairly regardless of income, Cox Branson scored a D.
Here's why that matters. They sue patients. Hospitals with strong ethics policies do not take patients to court over medical debt, especially not in a rural community where people are already struggling. Suing patients is a choice. It's a policy. It reflects leadership priorities.
Plus, I will just mention, Cox not only has billions of dollars in assets, this not-for-profit hospital Cox most likely participates in receiving grant money to cover indigent costs. So if so, the grant is paying and they are suing over the same items.
Another reason for the D is they only provide a detailed bill if you request it. That means no automatic itemized bill, no transparency, no clear explanation of charges, no way to verify errors unless you know to ask. Most people don't even know they can request an itemized bill. Hospitals count on that.
Why this is a D-level failure? Because ethical billing is about trust. If a hospital hides the details and sues the people it serves, that's not an A-level institution. That's a collection agency with hospital beds. Informed consent, C. This is the foundation of patient rights. A C here is unacceptable.
Informed consent means before any procedure, the patient must understand what's being done, why it's being done, who will be doing it, what the risks are, what the alternatives are, what the recovery looks like. This is not optional, it's the law. Cox Branson scored a C because doctors don't always list who will be in the room. This means you may think Dr. Smith is doing your surgery, but a trainee, resident, or someone you've never met may be doing major parts of it. Patients have the right to know exactly who is touching their body. They don't use the teach-back method. Teach-back is the gold standard for informed consent. It means the doctor asks, can you tell me in your own words what we're planning to do today? This ensures the patient truly understands.
Without teach-back, patients sign forms they don't understand. Risks aren't fully explained. Consent becomes a signature, not a conversation. Misunderstandings lead to preventable harm. Why a C is dangerous. Informed consent is the bedrock of patient rights. A C means the foundation is cracked.
Responding to never events, D. They apologize, but they don't make their never event policy available to patients. This category alone should make people pause.
Because a never event is exactly what it sounds like, a medical error so serious, so catastrophic, so preventable that it should never happen. Not once, not ever.
These are not oops moments. These are life-altering, lawsuit-level, career-ending failures.
Preventing patient harm, mixed but misleading.
Cox gets A's in nursing hours, RN hours, leadership to prevent errors, staff working together, hand washing, but these are internal processes, not outcomes.
Meanwhile, percent of BSN trained nurses, C, never events, D, safe surgery checklist, complex, D, safe surgery checklist, outpatient, D.
Okay, let me jump in here for a second because this part matters more than people realize. A lot of folks hear RN and BSN and think they're the same thing. They're not. An RN is a license. It just means you pass the boards and you're legally allowed to practice. You can become an RN through a 2-year associate degree or a hospital diploma program. Those programs teach you the basics, how to give meds, how to chart, how to follow orders. A BSN, though, that's a 4-year degree. And those extra 2 years aren't fluff. They're where you learn advanced assessment, critical thinking, how to recognize early signs a patient is crashing, how to prevent complications, leadership, evidence-based practice, communication, and patient education. Hospitals with more BSN-trained nurses have lower death rates, fewer medication errors, and better outcomes across the board. That's not my opinion. That's decades of research. So when I see Cox Branson scoring a C in the percentage of BSN-trained nurses, that tells me their nursing workforce is less educated than national safety standards recommend. And look what else they scored low on. Never events, D, safe surgery, checklist for complex cases, D, safe surgery checklist for outpatient surgery, D, those are the exact areas where you need highly trained nurses who can catch problems before they become disasters. So yeah, when you put all that together, the straight A hospital slogan doesn't match the reality.
So leadership gets an A, but actual catastrophic errors get a D. It's like giving a pilot an A+ for attending safety meetings and a D for actually landing the planes.
So sounds like what that really means is Cox gets an A for what leadership claims to do, and a D for what actually happens to patients.
That's the contradiction.
All right, team, let's talk about one of the most important parts of the Leapfrog report, medication safety. Cox Branson gets an A overall, but when you actually open the categories, you find things that make you stop and say, hold on. Here are 3 numbers straight from the Leapfrog site, CPOE, electronic ordering. Leapfrog gives Cox a considerable achievement for medication ordering. With our grades, that is a B.
Even though 16 to 25% of inpatient medications aren't entered electronically. That means up to a quarter of meds bypass safety checks and aren't documented through the system. In real practice, every medication should be in the chart, 100%. That means up to 1 in 4 medications bypass the computer system that checks for allergies, drug interactions, wrong doses, wrong patient. When you skip electronic entry, you skip the safety net. That's how overdoses happen. That's how interactions get missed. A B sounds fine, but in real life, that's a huge risk.
Medication discrepancies, 0.171.
0.171 unintentional discrepancies per medication means Cox averages about 17 medication mistakes per 100 meds given, roughly 1 error for every 6 medications. For a patient on 10 to 20 meds a day, that's 2 to 3 discrepancies per patient per day. This is not a small number.
These aren't typos. These are things like wrong dose, wrong time, med given but not charted, med charted but not given, conflicting orders. This is exactly the kind of chaos we see in bad outcomes.
Outpatient home meds documented 50%. Hospitals are supposed to document 90% or more. Cox documented half.
Cox Branson documented only 50% of patients' home medications for outpatient surgery, meaning half of what people were taking at home never made it into their chart. I don't think I even need to say why that is so extremely dangerous.
If we don't know what you're taking at home, we can give you something that interacts. Miss a medication you depend on, duplicate a drug, misinterpret your symptoms. This is basic safety, and they're missing half the information.
So imagine you are a juror in a malpractice case, and you are told this hospital didn't know half of what the patient was taking at home, or 1 out of every 4 medications bypassed safety checks, or there were 2 or 3 medication mistakes every single day to every single patient. People don't hear statistics. They hear risk. They hear carelessness. They hear avoidable harm. And when a hospital's out there bragging about straight A's, but the fine print shows this, That disconnect destroys credibility.
If a daycare only knew where half the children came from, failed to properly track 1/4 of them, and regularly mixed up records, it wouldn't receive an award, it would receive an investigation. And yet, they put an A on a billboard and hope nobody reads the details.
Star infections mixed bag. C. diff A, bloodstream infections B, MRSA B. Again, not failing, but not straight A. All right, let's move into the part of the Leapfrog report that honestly shocked all of us, the surgery section, because this is where the straight A hospital narrative completely falls apart. Complex adult surgery, D. Here's what the Leapfrog data shows, and these numbers are straight from the site. Total knee replacements, 7 per year. The national safety standard is 50. Total hip replacements, 23 per year. Again, the standard is 50. Safe surgery checklist, D. This means the surgeons performing these procedures at Cox Branson do not meet minimum volume standards, not even close.
Why this is a problem. In surgery, volume equals skill. The more you do, the better you get, and the safer the outcomes. A surgeon doing 7 knees a year isn't a knee specialist. That's someone doing knees on the side. And when you combine low volume with a D on the safe surgery checklist, meaning they're not consistently confirming the right patient, right procedure, right body part, right equipment, that's how preventable surgical disasters happen. This is not nitpicking, this is basic surgical safety.
And from a patient perspective, people don't want a surgeon who does a major joint replacement like it's a hobby. They want someone who does it every day, every week, all year long. Someone who has seen every complication, every variation, every curveball. When patients see numbers like 7 knees a year, they go elsewhere, and they should.
And it doesn't get better when you look at outpatient surgery, the safe surgery. Checklist D, patient experience D, home meds documented 50%. Hope, explain why these three together are a disaster.
Outpatient surgery is supposed to be the safe stuff, the routine procedures. But here's what Cox's scores tell us. AD on the safe surgery checklist means they're not consistently doing the most basic safety steps, the surgical version of a pilot's pre-flight checklist. A D in patient experience means patients are telling you, loudly, that something is wrong. Communication, pain control, follow-up, respect, clarity, all of it. And only 50% of home medications documented? That means half of the patients walk into surgery, and the hospital has no idea what they're already taking. No wonder the patient experience is bad. No wonder the outcomes aren't strong. You can't keep people safe when you're missing half the information.
So now imagine an airline that gets a D in flight safety, a D in customer experience, and only half the passengers' bags make it to their final destination, yet they advertise as an award-winning airline. Now raise the stakes. This isn't about a vacation. It's your knee, it's your hip, it's your life. Low volume, no checklist, missing half the critical information. That's not a surgeon. That's a hobbyist with a scalpel.
And that's the truth behind the grade. Cox can brag about an A all day long, but when you break down the categories, the areas that matter most and weight them, where amputating the wrong arm doesn't have the same grade weight as scheduling a nurse or 40 hours. The final verdict.
Cox Branson's straight A is a marketing slogan, not a reflection of actual patient safety.
When you break down the categories, the A's are mostly internal processes and minimum standards. The B's are partial compliance. The C's are below standard.
The D's are in the categories that matter most: preventable harm, surgical safety, never events, informed consent, billing ethics, outpatient patient experience.
Weighted by seriousness, Cox Branson earns a D, and that's the real story behind the grade. Remember, patient rights aren't optional, accountability isn't negotiable, and integrity is doing the right thing, even when no one is watching. Do you have a story we need to hear? Vital Signs and Verdicts is looking for local stories from people who've lived through medical failures, systemic failures, preventable harm, documentation issues, accountability gaps, or anyone fighting for transparency and oversight in our hospitals. If that sounds like you or someone you know, we want to hear from you. Subscribe to our YouTube podcast, reach out and tell us why you'd make a powerful guest, as a patient sharing your experience, as a family member seeking answers, or as someone with insight that belongs on our panel. Your story matters, your voice matters, and this community deserves the truth. So contact us today.